all about IHSS now. Okay, so in-home supportive services available in the state of California, but because I was just made aware that we have people out of the state participating. There tend to be other programs like this in other states, but their application process may be slightly different, as well as the eligibility process. So again, 65 years of age and older, disabled, or blind, it's an alternative to keep you safe in your home. We go to the next slide. You must physically reside in the United States. For IHSS, you have to be a California resident. You have to have Medi-Cal. So I'm going to speak briefly about the Medi-Cal piece. You can go to your local county office, social services, and they can help you with the application process for applying for Medi-Cal. There are some income guidelines around the program. So you will have to speak with your individual county and representative of the eligibility workers to figure out if you qualify for Medi-Cal, or that's Medicaid in other states. And you must live at home or in a location of your own choosing. You can't be in a long-term care facility. You cannot be in an acute care hospital, but you can, for instance, live in a motel. That is an option now because that is considered your own home and your own dwelling. And the key to IHSS is all the paperwork. So you have to complete the state mandated healthcare certification form. That form must be completed by your primary care doctor. I like to tell applicants, make sure it's a medical provider that knows you best. For some people, if your criteria for needing assistance is based on mental health, it will be your mental health care provider. It would fill out that form as well. They should be licensed. That is important because that is documented on the form as well. Next slide. So all of the application packet, you have the health certification form, you have the state application for social services. So these are two different forms. So the first one's probably 2 pages. The next one's probably 5 pages. And then the county specific. So in Alameda County, they may require certain paperwork versus Contra Costa County may be something different. So again, most of IHSS requirements is going to vary county to county. But other pieces that could add to time in your case, because that's what it's all about. How many hours can you get for someone to pay for someone to come into your home and help? You can add in things like range of motion, which is essentially physical therapy exercises that you have to do at home. Paramedical, that's things like maintenance of a catheter, if you have an ostomy bag, or wound care services, and you need assistance with that. And finally, protective supervision. That is one that the county does not advertise much about. It is usually reserved for people that have mental impairment or dementia, Alzheimer's to that extent, and they are putting themselves at risk. I think this is important to note because in some cases with sickle cell in particular, maybe the meds influence how we behave. So that is something that we need to be mindful of. The protective supervision is also an option that we can advocate for. And what it does, it maxes out your hours. It averages out to 9 hours per day that someone could be in the home assisting you. Next one. Sure.
How long is the application process?
Oh, that's a trick question because it depends on each county and how on top of things they are. So for instance, I used to work in Contra Costa County. Here comes a bunch of shade. They were slow and behind and they were short staffed. So people might apply on December 1st and may not hear back about their intake, where the social worker comes to the home for 2 to 3 months. So that is not the norm, should not be the norm, but unfortunately, if they're short staffed, that can be the wait time. The good news, if you applied on December 1st and your case is approved, your provider will be paid from December 1st. Even if it took 3, 4, 5 months for the county to get out, you will be paid from that application date.
Can you do multiple applications?
I would not recommend it. They're going to take the oldest one, and well, you want them to take the oldest one because it gets you the furthest date back and it gets you the largest range of payment.
Do you recommend our social to get someone assigned to us? How that we are
They are supposed to be able to return your phone calls within 24 to 48 hours.
Would you recommend doing phone calls?
emails. Keep your paper trail with the county and all state services. Absolutely. Great questions. So the assessment process, the county worker is going to come out and interview at your house. It's called in-home care. We come to the home to assess. And we're looking at whether or not you are capable of handling certain tasks on your own, and if you need help with those tasks to be safe. They can talk to you, they can talk to family members, they can talk to caregivers. Sometimes that does not work to your advantage. You should be your best advocate, but for those that cannot speak on their own, you do need that caretaker present that can really say exactly how much help you may need. This is very important for parents of children with sickle cell. You have to be that advocate for that child and say what they need help with, because children, it is harder if they're under the age of 5 to get those cases approved. Poor Smiles. That's my kid. He's a Capricorn. He's big on money. A completed application packet must be received by the county before they will give you a decision about your case. And I want to emphasize, if you're approved, great. But if you're not, you absolutely have every right to file an appeal. And there is a neutral third party that makes the decision on that. They look for things like whether or not the county social worker in that department was consistent with how they came up with the decision about your case. So if they denied it, they have to justify that. And if they find, sometimes they're proven wrong, like the county didn't handle it right, so then they have to grant the case. And again, it goes back to that original application date. So a lot of people get lump sum checks, be a couple thousand easily. And once you're approved, you have to hire somebody. So the client becomes the boss. You do the hiring and the firing, you do the training. But there are different resources available in each county that helps you learn how to take on that role, learn how to train your provider properly. But yeah, it's your responsibility. So that's something that you need to be mindful of as well.
And does the county give you a list of every person that's in their own districts?
Sometimes they do have a provider's list. The agency is called Public Authority. So you have people that have gone through, in some cases, some training, or at least some other jobs that they've held within IHSS, taking care of other people, where, you know, these are the people that are recommended. I can tell you the best way to find a good provider is word of mouth. Or if you already have a relative that you want to help, it could be a relative, it could be sister, mama, cousin, whoever that can come in and help. So it's a good financial resource for families, especially if you have someone that cannot contribute to the household because they're too sick to go work. So this little extra money can help. That is the good thing about the program. But yeah, you do have other people that can come in that are not related, and sometimes that's needed for some families. So that is an option. Go to the next slide. Yes.
So in the process of people selecting their doctors, so to speak, sometimes they have to obviously call the health providers to get the list of people that are available, or they can search that to their network, obviously, you can get paperwork, this website. Do you say that you get to the provider to find out the list of people, or do they send you an email? Which way do you think it's better for these people to find their provider?
Given the caseloads the social workers have, it is in your best interest to initiate that call to the county and request a list. Some counties do weird things, like they only send 3 at a time. I've never understood that. But they might send 3 people for you to call individually and see if that is a good fit to work with you and your family for your care. That is that's a tricky thing, because again, that varies county to county. Yeah. Okay, the types of things that IHSS will cover: house cleaning, meal preparation. So the cooking, the cleaning, the dishes, all that good stuff. House cleaning, that includes vacuuming, mopping, sweeping, all the stuff we may not actually want to do on the day-to-day. I wish I could have an IHSS provider. Laundry, grocery shopping, that includes putting the groceries away when they get them. But the big category is personal care services. So if you need help getting to the bathroom, if you need help bathing, if you need help with personal grooming, and that includes, you know, haircut, shaving, nail clipping, those are the things that IHSS can cover. Paramedical services is that special category where you can get a lot of hours, but it's where you need the provider to physically assist with something on your person, or like putting medication, mix it into applesauce and spoon feed, get it to someone. If it enters the body and the provider has to put it in the body, that falls under paramedical services. So that's why I mentioned earlier the ostomy bags, catheters, things like that, that are more medically oriented, and your provider should be trained on those tasks. And usually it's a nurse or what have you that will train your provider on how to accurately administer those things. Accompaniment to medical appointments is also another big category where, you know, sometimes you just need a ride to the doctor. Maybe you need grocery shopping, and maybe it's not that you need help with toileting, but just, you know, getting that haircut and keeping things nice and groomed. But sometimes you need help getting to an appointment. So they can pay for that. What IHSS does not pay for, last time I checked, is gas. So there are cases where the client and the provider will make a deal with one another so that they work out how to pay for gas and the commute time and all that stuff amongst themselves. And again, protective supervision for the mentally impaired. That is what maxes out your case automatically, 283 hours per month. A little over, depending on the rate of pay for the county, you can expect about $4,000 a month, a little bit more than that, for those cases. So if I'm taking care of a parent that has early dementia or Alzheimer's, you're trying to cook or something like that, and you need to watch them all the time, that would be protective supervision. If you have medication that makes you kind of delirious and you start doing weird things, maybe you're getting up in the middle of the night and opening the door for strangers. You don't have to be demented to do that. It could be the meds. That would fall under protective supervision. The county does not tell you these things. This is one of the most guarded areas that a lot of social workers, when they go out, they do not thoroughly explain, but you have so many rights and access to these hours. The reason why they don't do it is because that's the one that pays the most.
So with that, so the cash usually is set around 4,000.
Well, it can be higher because each county pays different rates. San Francisco pays the best. It's like $19.50 an hour, I think.
Yeah.
Right. They have the money to do it. And it's crazy because in the Bay Area, you'll see the ranges. I think Contra Costa County is probably the lowest in the Bay Area. Marin, Solano are comparable, but I do think that I have the rates in one of the slides. So that's what makes a difference.
So with that in mind, let's say you do those asking for the a lot of money at the same. Is that 5,000 you can
There is not. So, and it's not about the money. IHSS looks at the number of hours. So if the maximum number of hours is 283 and based on the pay rate, it comes out to 4,500, something like that. But it's based on the number of hours of need, right? So that's the part to really focus on is where do you really need the help? How you can rack up those hours that way.
Karen has a question for you.
Sure.
Thank you so much. I just wondered if you could repeat that part about
Protective supervision.
yeah, the part, I guess so. Yeah, the last part about they don't really talk about it so much.
Yeah. So and I fought with supervisors on this issue frequently because it is a service, it is provided by the state, it is covered by Medi-Cal, but because protective supervision maxes out the hours for a case to 283, those checks are going out monthly, right? So this is why they don't share that information. But there are so many things that can fall under protective supervision dealing with mental impairment. And like I said, that can be from medications. It could be from a diagnosis, a mental health diagnosis. It can be schizophrenia, bipolar. Maybe this person is having severe manic episodes and Maybe it's a young adult that's highly sexually active. There's a whole range of things that can fall under mental impairment and qualify an individual for protective supervision. Most of the time, social workers will only speak to the dementia and Alzheimer's. That is because this program is largely designed for the elderly. But that is something that I like to emphasize to people, because if you're disabled, if you're blind, and there's a mental impairment that accompanies any other physical diagnosis, protective supervision is something that needs to be assessed as well. Yeah.
Thank you.
Person that's being supervised needs to go to a family member's home. Is it required or asked that the family member come to that person, or will that person be able to get their supervisor to drive them to a family member's home?
You're saying for the client? Okay. Yeah. Medical appointments, yeah. So it's tricky. So when I assess for medical appointments, I leave that kind of open. The one thing that they explicitly state in the regulations is that we don't take patients, we don't take clients to church. So they won't do it for religious reasons. But if you can spin it to make it like this is a therapeutic visit, then you can count that under medical appointments. Yeah, but most of the time they are literally thinking about visit to their primary care doctor, to specialists. When you have children with sickle cell, maybe they have, you know, appointments in GI, in dermatology, in addition to hematology and the primary care doctor. So all of those things would fall under accompaniment and taking them back and forth to those appointments.
It's just a matter of being able to spend things.
Yes.
Or not just
Yeah. Yeah, and I'm extremely biased because I am a mental health care provider, but that is part of sickle cell disease that we don't talk about enough, is the depression that comes with sickle cell. It's hard dealing with chronic pain. It's hard being confined to a hospital bed multiple times throughout the year. So there's a larger impact with the mental health component that we don't talk about. But these two last 2 points about accompaniment to medical appointments and protective supervision, they aim to cover a lot of that.
Awesome. We have
Sure.
Hi, so I'm wondering, for example, my nephew and I live together and he has sickle cell, and we're looking at this IHSS in terms of the fact that we live together. Would that be an issue? Or is this the kind of service he would only be able to apply for once he's living out on his own?
Okay, I'm sorry, I didn't hear all of that.
So I live with my nephew who has sickle cell. And my question regarding the IHSS and the need to have it being your own dwelling, does that mean singularly in your own dwelling, or the fact that we live together, would that be something that would disqualify him from?
So where, if a person is living in a household, because a 5-year-old is not going to go out and get their own apartment, right? So you can be in a household with other people, whether it's parents or extended family members. But what they will do on the non-personal care services, so the house cleaning, meal prep, laundry, grocery shopping, they will prorate that by the number of people in the household. So 5 people in the household, if you're going to get 6 hours a month for house cleaning, they will prorate that. So 6 hours divided by 5 because of the 5 people in the household, and they will give that number to the one person that is the client for IHSS.
Perfect. Okay, thank you.
Yes, absolutely.
Karen, you had a question?
Yeah, especially for the last speaker, I just wanted to say I'm a caretaker for my former foster son who has sickle cell disease, SS, and I actually am on. I'm getting some, not probably as much as we could be, but some IHSS for him. But I learned through somebody else that if you're living with the person, you actually can fill out a different form, or once you get it and it gets going, you fill out a form that you're living with the person, and then you won't get taxed on it.
Right.
Yeah, that's really critical and helpful.
Yes, because there are 2 exceptions that the state of California makes. One of them is if you are living with, the provider is living with the client for the purpose of care, and that you aren't supposed to be taxed. And then the other one, I think, is for like if you are in a rural area and there aren't many providers available. So maybe you have 2 children that are on the spectrum and have behavioral issues, and you can't find someone else that can take care of those kids specifically. So your hours actually go above and beyond that 283 because there's 2 different cases, and you would apply for an exception for that so that the number of hours are granted, or I think it goes up to, I want to say maybe like 360, 380, something like that. So that would be monthly, but it's divided between 2 clients. But that is an exception you would have to apply for with the state. Yep. So this one just goes into each category, each authorized task that the county pays for. And it just gives you the very specific stuff. So when you talk about cleaning up, we're talking about cleaning the oven, the stovetop, the refrigerator, the sinks, all this kind of stuff that like they really get down to the nitty gritty, emptying the trash, range of motion for personal care services, rubbing skin. So if you have to do massage for a sickle cell patient whose legs are throbbing, you should be getting time for rubbing skin. Repositioning, every CNA, RN, LVN, they know repositioning is supposed to happen at least every 2 hours. So they should be calculating that according to what the standard is for that person's care based on the medical profession that usually cares for them. Assistance with prosthesis or meds. So that med management piece, making sure they're getting their meds on the time, setting up a Medi-Set. You get time for all of that. Help with walking. Sometimes you don't need to be assisted completely, but maybe you need help standing up, sitting to standing, getting in and out of the vehicle. All of those things should be covered under personal care services. And this is the category they cannot prorate. So if someone needs baths to help with pain management, your time for bathing is probably not going to fit nice and neatly into the chart that the state typically uses. So they would want to over assess as far as time in certain categories. I am also going to be an advocate for personal grooming. This is something that we had a whole debate about in Contra Costa County. With people of color, our hair is different. It takes time. So we had a supervisor that didn't understand why a client, it took 4 hours for her to get her hair done. And he's like, are you serious? I'm like, that's a Black woman, yes. And that sounds pretty quick. It depends on what style it was. So these are the things that matter, right? And they don't stop and think about it at the state level, but these are things that you can absolutely advocate for. And you will be well justified in doing so. Blood sugar checks, injections, other paramedical services, that is something that's covered. So 2 medical appointments and alternative resources. So when I was talking about therapy, those therapeutic visits, all of that falls under accompaniment to medical appointments.
So quick little interesting fact about it.
Yes.
So even though you know that you
It's supposed to be every 2 hours. Isn't it? Because if you don't, you get bed sores. Yes. So the skin breaks down. So you are medically justified 24 hours in a day, 12 rotations. If someone is bedbound. And depending on the size of the person, it may take more time. You may have to use a lawyer.
Now you understand.
So all of those things matter.
Change that negative activity that's going on in your brain. Now it's time to just react.
Getting the actual supervisor that's going to be on hand with us,
Mhm.
we get to interview that person, or they just provide it to us?
No. You are hiring that person, the provider. Yes, you are hiring that person. So I've had clients with mental impairment that was rotating through providers like every 2 weeks.
Mhm.
And that sends up a flag for county, because we're like, okay, so what's going on with this individual that they're rotating through these providers so quickly? What's going on? So when you look into it, and maybe there's another level of mental impairment, mental illness going on,
Yeah.
those are other things that we have to address. So when the client can be, be problematic in that sense, the county will restrict that person from using their database for providers. Then you're on your own, find your own person. Yeah, so there are restrictions. We've had people that have made racist statements to providers, people that have flipped out, assaulted their providers, like they get banned from the list. You can't use us anymore. So
This might obviously question answered. Sometimes we have certain statuses and other. He's the mission to be doing it for another person. That person, let's say I get to a point myself, right? I really just feel like anybody you provide me over this course of reviews. If I need somebody that I feel like I can most trust, that person has to go through an application process,
Yes.
certification, and everything, right?
yeah, so with public authority, that is basically the human resources for the providers. They do the background checks. So everyone's fingerprinted if they're a provider. There are certain, you can have a criminal record. It's just certain crimes you cannot have committed, such as abuse of an elderly person. Like, we're not gonna hire somebody that has abused elderly people as a person to care for the elderly. So, common sense things like that, or theft. There are certain things that you can steal. Maybe you're stealing from Target, but don't you dare go running through this person's bank account. And it's crazy because they rank the crimes or felony and misdemeanor for what is acceptable as being a registered provider with public authority. Yeah.
I assume that
Yes.
and to provide all of this for that child.
Right. Exactly. Those are one of the exceptions that the state will make, especially if you have a child with mental illness, or if you have more than one child with mental illness. The other thing with that, if it is a 2-parent household, the understanding is that one parent is not able to work a full-time regular job because of the care needed for the child.
Right.
The other parent can go to work. One has to be, if they want to be the provider, that has to be the situation. Like, I can't work a full-time job because I have to care for this child. Okay, we'll let you be the provider. If there's a way that one parent is working full-time, one parent is working part-time, they may not allow that parent to be the provider. And financially, that may be the better option for the household.
We have a question from Shirley, which is in the security.
Sure.
Most Medi-Cal eligibility for serving, she has a PhD. Is that qualified, or how do we get Medi-Cal eligibility?
So you would have to go through your local county and apply for Medi-Cal. There are, I think, some health diagnoses that would probably be more likely, to approve a Medi-Cal. So it's basically just your insurance coverage, right? So you can get approved for Medi-Cal. Now, if you make too much money and they use the federal poverty limits to determine that. If you make too much money, according to the county, according to the state, there may be a share of cost, which means you have to pay whatever that share of cost is before your Medi-Cal kicks in. For some people, the share of cost, I've seen it as high as $2,000. It does not make any sense to pay $2,000 a month, and then you get 50 hours a month of IHSS services. It is not cost effective. So what the social workers are supposed to be doing is looking at that share of cost to make sure that it's cost effective for you before they even do the interview and assessment. I've had people that had $2,500 a month assessments. I've looked over the application. I can kind of gauge, okay, they're not going to get that many hours. They're not going to get maxed out. I explain this to them before I even go out for an interview, before it's even scheduled. And then they, some people's like, okay, well, I would rather hire somebody on my own and pay out of pocket for the care.
Good question, Shirley. Kiana asked, are you likely to receive the tools during the season?
Yes, I would say yes, because that's another layer of assessment with Social Security. They're probably a lot more rigorous than county. So if you have SSI, that also tells us about your income. So that will qualify you for Medi-Cal. You would be eligible to apply for IHSS. And obviously there's a health situation that lets us know that you would qualify for services.
Awesome.
Yeah.
Let's move on to the presentation.
Awesome. So this is the hourly task guideline. This is on the state website. So if you go to California Department of Social Services, CDSS, I think it's .ca.gov, you will see this chart. This is what the social workers use to determine how many hours you get. So what they did by creating this chart is remove the bias of the individual social worker showing up at your house. Because maybe they're quick and efficient with certain tasks and they don't think it should take you that long. Well, the state set a standard for what is low end of that time and what is the high end of that time. So again, preparing meals. The low end, they say, okay, rank 2 means you just need verbal prompting. So you might get 3 hours and 1 minute is very precise per month for verbal prompting and meal preparation. Rank 3 means you need some help. Rank 4 means you need a lot of help. And rank 5 means you need total assistance. So if you're rank 1, you don't need help in that area and it's not even on the chart. But this chart tells you the maximums, the minimums, menstrual care, repositioning and rubbing skin, prosthetic and medication. It tells you everything. So they're just plugging in these numbers largely. And then the computer does the calculation, but it removes the bias of the social worker that may have an opinion about you and your family and how you guys run things. And they try to, level the playing field for everybody applying for services. That is the purpose of this. Next slide. So the thing I want to emphasize, you have every right to file an appeal. So you can ask for a state hearing if you disagree with the county's actions. This is even if you're already approved, you had a reassessment and they didn't give you enough time. You can file an appeal. If you file that appeal, they have to pause everything on the case. They cannot reduce your hours during that time that they're reviewing that. If it goes to the level of the law judges, so you request a hearing, either you didn't get assessed properly, you didn't believe what you should get, or you request a hearing prior to the effective date of the new. So they do the assessment and then they give you a future date for when it takes effect. So that's the period that you say, hey, we need a review. Your benefits won't change. So they can't change anything on your hours, they can't cut them. And you can request a hearing by going online or you can call. But those numbers, that information should be on your notice of action that you receive from the county about your services that they have approved. So it'll have everything printed out, a long form of all the hours that you have been granted. And if you have a problem with it, by all means, file the appeal. And the next slide. So the state hearing is heard by a state administrative law judge, neutral party. The county has to send somebody to explain why they did what they did. And they better have all their ducks in a row. They have to use the regulations, and the regulations are your friend too. The state hearing is not a court hearing, so it's not the same situation. You sit at a table and talking about it, but you have the right to have somebody with you. So if you get anxiety being in these situations, there's legalese and you don't feel comfortable, bring your advocate, bring your caregiver, somebody to support you in that. You don't have to even speak up for yourself. A child cannot, so it could be the parent, it could be someone else. And free legal services are available in every county. So you can get consultation. They have to provide an interpreter if you need one, and you can bring witnesses. So if the social worker came to your house and they didn't even ask you about what meals you prepared, and you're like, no, we do traditional meals on Sunday, and they didn't even go into detail about the time that it takes, your witness can speak to that. Like, y'all didn't even ask about that. And that is something that will help you get more time in that area of your assessment. Yep.
Is there a specific site where those legal services can be?
The area legal aid is like the one that comes to mind because they have several locations throughout the state. Free services, and I know they deal with a lot of like the rentals problems that were going on.
Is that aid spelled AIDE or AID? AID.
Legal aid. Offices, like I know Richmond had a local office. So, very, very useful.
Awesome.
So current pay rates for the county. So Alameda County is at $18.10 an hour. Contra Costa is what I was talking about earlier, $16.50 an hour. Marin, $16.95. Napa, $16.95. Sacramento, $16.50. Contra Costa and Sacramento have the same rate. That's ridiculous. Cost of living is totally different between the two. San Francisco is at $19.25 an hour. San Mateo County, $18.20. Solano, $16.70. Sonoma, $16.85. Lowest in the state is $15.50. And I think that's in 3 different counties. Calaveras is one of them, but they're the ones that are kind of out the way, not too many people there in the first place. But the pay rates do vary, and you do want to check with that. The providers do have their own unions, so they're always fighting for increase in pay. So yeah, sometimes it is about the money, I'll be honest. I've gone into assessments and just asked the client, like, is it about the time and really needing help, or is it about the money that you need in the family? And I have honest conversations with the client about their goals in applying for IHSS. Not every social worker is like that, but game recognized game. And I'm a realist, so I'll ask people about the things that really matter to their household and try and work with them around meeting those goals as well as meeting the care needs. But again, that's where that knowing the rules of IHSS, knowing about the regulations, how all of that comes into play. And again, if anybody is going through the application process or going through a reassessment process, more than willing to help you with that. I can go through your case line by line and find out where we can get more time. I need to put that on a t-shirt. Line by line and get you more time. When I write my book, I'm gonna post it on Amazon on how to finagle get over on IHSS. This is another program, GHPP, and this one really it's about navigating the website. So it's www.dhcs.ca.gov. And the eligibility, if you go to the next slide, I can just tell you briefly, GHPP, Genetic Handicap Persons Program. So they cover a lot of different diseases, but sickle cell is one of them. Sickle cell disease, not traits. Thalassemia is on there. So yeah, blood disorders is a big category under GHPP, and they help the beneficiaries with their healthcare costs. So let's say you already had employer-sponsored coverage. So you work, you have your coverage for your job. You can get a supplemental plan through GHPP if you meet the income requirements. And that can help like with out-of-pocket costs. I was in a situation in, what was that, 2015, where I worked for Contra Costa County and I needed a service. No, I take that back. It wasn't even Contra Costa County. I had Kaiser coverage as a county employee. I could not go to the county hospital because I had Kaiser. Kaiser didn't cover the procedure that I needed to save my life, but the county did. I did not have GHPP at the time. If I did, I wouldn't have to worry about the cost of a plasmapheresis procedure to save my life. Fortunately, everything worked out because I had good advocates. I had a good hematologist who was like, no, get her out of here, get her to Summit so that this can work out. But having this in your back pocket is gold, especially so people with Medi-Cal, you don't too much have to worry about this because Medi-Cal covers a lot of the things and the coverage that you need for sickle cell. But for people that have employer-sponsored coverage, you need this because there's a lot of things. There's formulary lists with certain medications that may not be covered with Kaiser, for instance. And maybe GHPP can cover the cost of a specific medication that's not on Kaiser's list. So things like that help out with medications and different procedures that may come up, and you just have another bucket of money to pay for that. There is an application process. Again, like I said, with IHSS and county services, with the state, keep track of all of your records. You want copies of all of your paperwork that you submitted. Last time I checked, GHPP had like 2 people working in the office for the entire state. So they're shorthanded. That's why you want to keep track of your own records and files to make sure if you have to resubmit, all you're doing is just literally making copies and sending them again.
So Karen had a question.
Sure.
Karen.
So, thank you. I just wondered, can you use GHPP for dental coverage? I just,
So the question was, can you use GHPP for?
I believe there is a way to do that because if it is a disease of the blood, disease of the brain and the nerves, and there's a dental issue that can be connected to any of these, there's a way to spin it in the medical lingo and the coding for the bills that they will cover it.
thank you. I'll check it out. Thank you.
Yes. Yeah, I started listing all the different diseases. I didn't realize how many different diseases they covered under GHPP. These are the ones that matter to us, right? All kinds of stuff. Yep.
Go ahead, Sheila.
Good afternoon, everyone. This is very, very informative, and I really appreciate that your detail and expertise knowledge. This is awesome. I have a question as it relates, you're welcome, GHPP. I have Kaiser, and I go to the Inglewood Sickle Cell Center of Excellence. And for the last 3 years, Kaiser, they have not billed GHPP for, say a copay type situation. Though I go, regularly, and I've been paying premiums, because of income. GHPP has a sliding scale. So I've been paying premiums, but yet there's been no benefit. And so I am kind of in a quagmire as to whether or not I should continue, or if Kaiser, and I'm also 65, so I have Medicare. So that's my question.
I'm guessing that it's not financially beneficial to you to even participate, especially with being 65 and you're already paying the premiums and not seeing the benefit. Also, Kaiser, Southern Cal, it sounds like they're very much so like Northern Cal, where they're not going to take that extra step of sending the bill that they would send to you directly to GHPP. So it creates more work for you to do if you want that reimbursement. But honestly, it does not sound like it would be cost effective in the long haul for you to even participate in GHPP. Personally, I'm in the same boat.
That was my judgment.
Yeah.
Thank you so very much. You just gave me a confirmation for me not renewing, because that's a couple thousand every year.
Yeah. It's like if you don't have a major procedure that you like, you know, on a regular basis, or the formulary list doesn't cover the meds, like Kaiser doesn't deal too much with the narcotic pain relief stuff anymore. So they're real sketchy about opiates. And Exalgo was one that worked for me, but I can only get that through TRICARE, and that was a 1 pill a day timed release. GHPP, I don't even think, because of the income, I was married at the time, it wouldn't have benefited me. to even pay that
Yes.
premium every month.
You mentioned something that was very important, and that's major procedure. Back in 2016, I had a complete right hip replacement, and it appeared that Kaiser may have billed them for some of the extensive lab work and things that had to be done. And so that's what I'm thinking, that I should probably jump in and out based on need versus paying each and every year.
Exactly. If
Okay,
you know
thank
you got a
you.
surgery coming up, you're gonna wait
Right?
for it the same way every other capitalist does.
Okay, I
Line it
know
up.
that's right. I know
Simple.
that's right.
Yeah, absolutely.
Thank you so much. You're excellent. Oh my gosh.
Here,
I,
the
I
trial and
would-
Adrian, you have your hand up? Are you?
That is well.
Unmute yourself.
Pat, you're on mute.
Can you guys hear me now?
Yes.
So on the Sheila, the GHPP you asked about,
Yes.
I would touch bases with GHPP first, because if you, for some reason, were injured outside of California or something in your travels,
Mhm.
you want the insurances that will pay for all of those kind of things. And so I would be very careful about just canceling it without first talking with them.
Okay. Okay. I hear you loud and clear. Mhm.
that's definitely a thing to double check with. Your
And
primary.
in terms of the dental thing, GHPP does cover dental, and they're actually very good with the dentist.
Oh, really? Good to know.
Yeah.
Okay. Yeah, absolutely. That's what we find out about when we go through things, right? When you get in a situation, you're like, dang, if I had known that, this is why I share all the information that I shared. Because I've been through some things, I've seen families go through some things, and it just didn't make sense, and no one told them.
So as a read, the question was, GHPP has made sense for me, or asked does it make sense for me? The response generally is yes. Ask first before you cancel it. Most of the time, some of the advice given at GHPP also for big surgeries, if it doesn't pay you financially, but as HHS mentioned, check with them.
Right.
We have been GHPP.
Right, insurance, right? Yeah, you don't want to come out of pocket for these things.
Great question.
especially There's a program. Again, just more.
Something that Shirley just mentioned, GHPP does cover out of state emergencies.
Yes.
GHPP also pays for emergency hearings. They do not pay for agriculture, but how.
Okay. And some Kaiser plans are now covering that. It just depends. Sometimes you get a good doctor that'll do an outside referral and not.
So
give hassle.
can you repeat what that person just said? Because the problem is that I can hear you, but I can't hear the person in the background talking.
Which part did you want me to repeat?
The GHPP covering outside. states.
The GHPP covers you outside the state for any emergency that you may have. And
Are you a long ways from your mic? Because those of us that are calling in, well, I in particular cannot really hear what you're saying in the background.
me as in the host, Kimball?
Yes, yes.
You can hear me okay?
I can hear you great. I just can't hear him.
Can you hear me now?
I can hear you a little better.
A little better. Okay.
What was mentioned was that GHPP covers you for any emergencies out of state. It also covers you for glasses and hearing aids but it's not gonna be for acupuncture or any type of chiropractic services.
So I kind of want to open it up to you guys to see if there are any other programs you have general questions about or any other questions that are floating around out there.
So my question is, I know we're talking about GHPP and that applies to adults. Do the same things that you're talking about apply to younger folks who have CCS,
And what is CCS?
California Children's Services
Oh,
Program?
like through foster care? Or no?
No, it's medical coverage for children with sickle cell
Northern or
disease.
Southern Cal?
It's all over Cal.
All over. Okay, that's a new acronym for me. Typically, if it's something state provided or Medicaid, Medi-Cal, Medicare programs, you're pretty well covered. So you don't really need the supplemental programs. And it like the children, I'm sorry, man, they get it great. Once you reach that 18 and over mark and you get kicked out of the pediatric system is when you start needing all those additional resources, to be really honest about it. They have a lot of care centers, well, not a lot. They have more compassionate providers, if you will, with children. And some of the adult providers lose that spunk, I guess. But yeah, the kids are pretty well covered for services. Unfortunately, they just kick us to the wayside.
Okay, so we're gonna approach intermission right now. I'll give you guys to just go ahead, grab your questions in order. This pretty much concludes the presentation part of it. We're just gonna do a Q&A to kind of end things off for about 15 minutes. We're gonna have you fill out an evaluation form during these 5 minutes right now. That will be provided on the chat link right there. So go ahead, just take these 5 minutes online, write down any questions you may have. Other programs you may have questions about, we'll answer in the Q&A that'll be coming up after the 5-minute break. And yeah, pretty much great job, Lauren. Thank you. Good job. So we're gonna go to thank you, everyone.
I'm gonna research CCS real quick.